Clinical Vignette, Puerto Rico Medical Board Style. Topic: Diagnosis of rheumatoid arthritis. Case: a 42-year-old woman presents with a 3-month history of morning stiffness lasting over an hour and symmetrical joint pain in both hands, particularly in the metacarpophalangeal (MCP) and proximal interphalangeal (PIP) joints. She also complains of fatigue and low-grade fever. Physical exam reveals swelling and tenderness in several MCP and PIP joints bilaterally. Laboratory studies are ordered. Lab results: rheumatoid factor, RF, positive. Anticyclic citrullonated peptide, anti-CCP antibody, positive. ESR elevated, CRP elevated, ANA negative. X-ray, joint space narrowing and marginal erosions in MCP joints. Question: which of the following is the most specific test for the diagnosis of rheumatoid arthritis? A. Rheumatoid factor, RF. B. Anti-CCP antibody. C. Anti-nuclear antibody, ANA. D. Elevated C-reactive protein. Correct answer B. Anti-CCP antibody. Explanation: A. Rheumatoid factor, RF. Commonly used but not very specific. RF can be positive in other autoimmune diseases and infections. B. Anti-CCP antibody. Most specific test for RA. Associated with more severe disease and joint damage. CNA. Not specific for RA. More associated with lupus and other autoimmune conditions. CRP. Marker of inflammation, useful for monitoring disease activity, but not specific for RA. Would you like follow-up vignettes on treatment, e.g. methotrexate? Clinical Vignette, Puerto Rico Medical Board Style. Topic: Treatment of rheumatoid arthritis. Case: a 35-year-old woman presents to the rheumatology clinic with a 6-month history of symmetrical joint swelling and pain affecting her wrists, MCP, and PIP joints. She reports morning stiffness that lasts more than 1 hour. Her labs show rheumatoid factor, RF, positive. Anti-CCP, positive. ESR and CRP, elevated. X-rays show periarticular osteopenia and early joint erosions. She has failed NSAIDs and low-dose prednisone, which only provide temporary relief. She asks about long-term options that can prevent further joint damage. Question: which of the following is the best initial disease-modifying treatment for this patient? A. Etanercept. B. Methotrexate. C. Hydroxychloroquine. D. Ibuprofen. Correct answer B. Explanation: methotrexate is the first-line disease-modifying anti-rheumatic drug, DMARD, used in RA due to its ability to reduce inflammation and prevent joint destruction. Etanercept is a TNF-alpha inhibitor, biologic, used if methotrexate fails or as combination therapy. Hydroxychloroquine is used in mild RA or in combination, but not typically first-line in moderate to severe disease. Ibuprofen, an NSAID, provides symptomatic relief but does not prevent joint damage. Summary of RA treatment strategy: 1. Start with methotrexate, oral or subcutaneous. 2. Add folic acid to reduce methotrexate side effects. 3. If inadequate response, add biologic agents, e.g. etanercept, infliximab, adalimumab, or other DMARDs like leflunomide, sulfasalazine. 4. NSAIDs and corticosteroids for short-term symptom control only. 5. Monitor liver function, CBC, and pulmonary function with methotrexate. Would you like